this is another patient that I just wanted to show. And this is a patient at the age of almost like 69 years. He has quit tobacco and he was brought to us by his son, and he's been able to completely quit tobacco. So these are some of the important aspects, and these are some of the papers or some clinical aspect that has been done, some trials and all. I don't think I'll go into details of it, but yes, there are multiple trials which have been published, which have shown that nicotine lozenges have got a better quit rate as compared to others, and can be given, and it is easily acceptable by the patients, and it increases the abstinence, it decreases the withdrawal symptoms for these patients. So these are some of the things. I'll just compare trials where they have been head-to-head comparison between nicotine lozenges and nicotine gums, which has shown that the nicotine lozenges is almost 25 to 27% more better or more supply nicotine on the constant rate as compared to the others. So this is another trial in 408 patients where they have shown lozenges has a better quit rate as compared to the gums. So these are some of the important trials. So I think I'll just if there are any questions, but if we can go ahead with that. Otherwise, I'll go ahead with some of the quiz questions I have put for 4, and all of you can answer to that. So can I stop here for any questions?
Sir, we can go ahead, sir. We'll take the questions at the end, sir.
Okay, right. So this is a quiz 1. What I would request all of the participants, just go through the quiz. There are 4 questions. Just put the answers on the chat box, right? You can start putting the answers in the chat box. The quiz number 1, a 32-year-old male has chronic cigarette addiction. He smokes more than 25 cigarettes. At what dose should we start his NRT? That means if a person is taking 25 cigarettes, what should be the dose of NRT? 2 milligram or 4 milligram? Okay, people are answering. I'm not able to chat box.
There's another link to it, sir. We are viewing it, sir. I think I'm seeing they are mostly answering it correctly, sir.
Oh, great. So just to answer it here, for all smokers who are taking 20 cigarettes or more than 20 cigarettes, that means who have got high addiction rate, we should start at 4 milligram, right? Anyone who is taking less than 20, we will start with 2 milligram, right? And the dosing system is also the same. That is, in the first week, till week 1 to 6, we give it at every 1 to 2 hours. Then after that, 2 to 4 hours, and after that, 4 to 8 hours, and then we stop, right? So, and sometimes in the high doses, we can even go down. If the patient requires much longer, from 4 milligram, we can switch to 2 milligram also in the later stages. So this is the next question. How long should you use nicotine lozenges? This is a standard. For how many weeks we should use lozenges? So you can put whatever is the answer. You can put it in the chat box. Whatever you think is the right answer. Okay.
Yes, sir.
So here is the answer. Nicotine lozenges, as I have said, the maximum dose we want to give it for 12 weeks, and after that we want them to go without, or they should stop completely. Very rarely, like those who have been very heavy smokers, where we can step down to 2 milligram for some more days, maybe for 2 to 3 weeks extra, maximum of 4 weeks extra, right? Otherwise, the most common standard procedure is that we have to stop after 12 weeks. So this is the third quiz. A person with age of 38 wants to quit smoking. So how many lozenges we need to give per day in first week? 4 lozenges per day, 8 lozenges per day, or 1 lozenges per day? Got it?
Yes, sir.
So it is generally 8. That is what we said. 1 to 2 hours every. It has to be started. If the person is taking less than 20 cigarettes per day, we start with 2 milligram. If the person is taking more than 20 cigarettes per day, we start with 4 milligram. But the dose is approximately 8 to 12, but we should not exceed more than 15 lozenges, right, per day. So the last quiz question, can we use nicotine lozenges in diabetic patients? Yes or no? It's very simple. Yes, that's the answer. It can be given. But the only thing that we want to caution is that once the patient is started quitting tobacco, there may be a need to readjust the doses of insulin if the patient is taking insulin, or if the patient is taking anti-diabetes, we need to reset the doses, right? That is to be done by the physician. So that's it. So just to end here, the tobacco quit program needs to be available. It is a feasible program. It is an effective program, and we are doing it continuously. And most important, medical treatment is available to quit tobacco. It is possible to quit. There are standard protocol, which I have explained for NRT, especially for the nicotine lozenges. And we need to have more and more tobacco cessation specialists, and they are now available in the market who can help the people through the quit journey. And specialized centers like physical and virtual, that needs to be made available at all the places. So this is another patient from Fiji, and she's so happy that she has been able to quit tobacco, and she's giving her, she had some lesions in the oral cavity also, that also has been taken care, and she's completely feeling good, and she went back happily to her Fiji. So these are some of the references. Thank you so much for your patient hearing, and I'm open for any questions. Thank you.